everyone, and welcome to our Q&A session where we're looking at endometriosis. I'd like to first start by introducing our panel. So my name is Caitlin Gould. I'm one of the co-founders of Kensa Health.
I'm Eleanor Rourke and I have endometriosis.
I'm Rose Abbott and I'm one of the co-founders of Kensa Health and I'm a GP.
And I'm Caroline Wiltshire and I'm also a GP with a special interest in women's health.
Perfect. So we're here talking about endometriosis today. Could you tell us a little bit about what endometriosis is?
Sure. So endometriosis is a condition where cells which are similar to the lining of the womb actually grow outside of the womb in areas where they're not meant to be. Now these cells respond to the hormones of the menstrual cycle in the same way that the lining of your womb does. Unfortunately, unlike the lining of the womb, which is shed during a period, these cells, when they bleed, have nowhere to go. So they cause pain and inflammation and scarring, which leads to the problems that we face in terms of symptoms from the condition.
And Ellen, you have endometriosis. Is that kind of speaking to you in terms of your personal experience of those symptoms?
Definitely. When we're talking about symptoms, what I'm thinking is pain, fatigue, inflammation, bloating, nausea, all those fun things that go hand in hand with it. But yeah, that sounds about right.
Perfect. So endometriosis, how easy is it for somebody to get a diagnosis of this?
It's actually really quite difficult to get this diagnosis. On average, it takes 7.5 years. For some people, that's a bit less. For some people, it's a lot more than that. The reasons that it's hard to get the diagnosis are partially because the symptoms can mimic several conditions, so it's often confused with other conditions such as irritable bowel syndrome, with the bloating, the tiredness and the disrupted bowel function, but also it can present similarly to other problems with periods, so other bleeding disorders. And the other thing is it's often not really necessarily picked up initially even by the person suffering those symptoms, because it may be that you think that is normal for you to have that pain, that fatigue, these unpleasant things, because you haven't been told that's not normal. Also, historically, it's not been disorders related to periods, they've not been researched enough, discussed enough. And the diagnosis is also mainly hard to get because we don't have a really good test for endometriosis, and the definitive way to diagnose it is actually through a laparoscopy, which is a small operation where you actually have to have a keyhole surgery through the tummy button to have a look inside and see if there are any of these abnormal tissues within the pelvis or within the abdominal cavity.
And that was the journey that you went on when you got your diagnosis. You got your diagnosis quite young, you're saying.
It's not necessarily, I don't know if it's luck or not luck to have endometriosis, but yes, I'm lucky in that I went from pretty quickly having an understanding that these symptoms weren't normal, which to begin with I thought, hey, this is just what women go through, this is part of being a woman, and it took a little while to realise that actually, no, it isn't. I went quite quickly from trying different hormone treatments to then going for the surgery, and I had 3 incisions and confirmed that I do in fact have endometriosis.
So once finding out people have endometriosis, if they have managed to get that diagnosis, what comes next? How did you feel when you found out that you had that diagnosis?
I think if I'm honest, I tried to ignore it for a really long time because I'm the kind of person that is a bit of a go-getter. I don't like anything to get in my way. I'm very strong and independent and also very stubborn. So for a while I ignored it and tried my best just to soldier on through. And it's taken actually years to come to terms with the fact that I have this condition and it does slow me down, it does impact me quite heavily. It impacts work, family, relationships, friendships, every aspect of my life. And I think the next step for me was just learning how to live with it. as full a life as I possibly could.
And I suppose that also interest in not wanting to power through it and not wanting to admit pain, that's part of the challenge around getting the diagnosis in the first place, is if women are kind of suffering in silence and not talking to their GP. So as doctors, how would you encourage women to be heard if they're feeling this kind of pain?
I think it's really, really important that women are empowered to talk about these symptoms and understand that then it's not normal. It's not normal when you're young to be having really heavy, painful periods. It's not normal to have bleeding between your periods. It's not normal to have pain during intercourse. It's not normal to have painful bowel movements or pain when you're urinating, during your menstrual cycle. So it's really, really important that women feel confident enough to go to their GP to discuss these concerns that they have, and if they don't feel heard by their GP, that they seek to find a GP who will listen to what they've got to say. I think I just can't stress that enough, really.
That's great. Now, obviously, whenever we're talking about a medical condition that impacts menstruation, it naturally leads on to the conversation about fertility and having children. What's the impact of endometriosis on fertility?
So when people are being investigated for fertility problems, 50% of them are found to have endometriosis. So it's a real problem when it comes to fertility. The reason why it's such a problem is because, well, it's not fully understood actually, but some of the reasons are that the endometrial growths can cause blockages within the fallopian tubes. It can affect ovulation from the ovaries because of both physical blockages with growths there, but also hormone changes and immune function changes. It can also affect how well an embryo implants within the uterus. And it can also affect how your body reacts to a pregnancy. So there's many reasons why fertility is such an issue when it comes to endometriosis, and why it's so important that one of the reasons it's so important that we learn more about it.
Well, I suppose it also means that diagnosis is quite important too.
Absolutely.
Because then everybody knows what they're working with.
Yeah.
Now, when you got your diagnosis, you were quite young,
Yes.
but you were saying earlier then suddenly you had to have a conversation at a very young age about fertility. What was that like?
At 19, you're not thinking about what am I planning for my family in the future. You're thinking about is the boy going to ask me out to go to the movies? Let alone am I going to have kids with him? It came as a really big shock, and I for a while just decided that I'm going to push myself into my career. I don't need to even think about that. It's not a concern. But as I've gotten older and had more relationships and kind of figured out what it is I want from life, it's become more of an issue. But having a conversation at 19 about hysterectomies or whether or not you should be thinking about freezing your eggs, those sorts of things, it comes as a really big shock, and it's a huge emotional sort of stress to worry about and to have in the back of your mind at a young age. But I think it's just about, you're saying things that I've not really heard before about how endometriosis impacts fertility. So it's really refreshing to have a conversation with a GP that is in the know. But I think it's just about finding ways to deal with the emotional stress that goes with it and not to stress it too much. Because yes, it's an important part of life, and as a woman, it's one thing that you can do with your body, great. But it's not everything if it isn't the option. And I think it's just about coming to terms with the fact that yes, it might be harder, it might be a challenge, and if and when you're ready one day, cross that bridge when you come to it. But I'm 22 and I've got things I want to do before I even think about that. So right now for me, it's I'm trying not to put too much emphasis or stress about it too much.
Perfect. And just to dispel a myth that does go around, a diagnosis of endometriosis doesn't mean you can't have children.
Absolutely not.
Okay.
And I think that's really good that you've had the diagnosis quite young to start, even though you don't want to be thinking about these types of things, it will impact you potentially from avoiding thinking about it until you're much older. So I think the problem we have with people seeking fertility treatments is that yes, there are some really good treatments to help if you do end up having fertility problems, and there's a lot that can be done to help people with endometriosis to actually go on to have a successful family and to have a baby. But if you get diagnosed late, then you may not think about those sorts of problems until you get older, and we know that it's much harder to deal with fertility problems once you get like into your late 30s, and then especially even more once you're like moving towards your 40s, early 40s. So it's brilliant to have that like empowerment that you know your diagnosis and you can try and minimise the complications of endometriosis by treating it early is also really helpful.
I think the thing to remember is that early treatment of endometriosis has an impact on fertility, but it also has an impact on the scarring that you would get, the adhesions, which means where different parts of the pelvis stick together and cause pain. If you have the diagnosis early, then you can get treatment early to reduce the risk of these things occurring later on. And so from a symptom point of view, having an early diagnosis and treatment is really beneficial, whether you choose to go on and have a family or not. I think early diagnosis, early treatment leads to a better outcome, really.
Well, like most medical conditions, the earlier you know about it, the more you know about, the more information you have about it, the more empowered you are as a person going through it. I think, as you said before, the fact that this isn't talked about much, that we didn't not like it wasn't even in the conversation until a few years ago, unless you were suffering from it, means that people wouldn't even know about pushing to get that diagnosis. They wouldn't realize that there is actually this chronic condition that can impact all parts of their life, whether they decide to have children or not. It can still impact their work life, it can impact their day-to-day life. So in terms of, with that kind of knowing it's so impactful, what types of things can people who either are pre-diagnosis or who have just had a diagnosis, what can they do to try to help live with this chronic illness?
So there's quite a few different ways this can be treated, but treatment in itself is not very straightforward for endometriosis, unfortunately, and we do definitely need a lot more research in this area to improve that. Before you're diagnosed, and that may take quite a few years, as we've already said, it's important to try and have some sort of effective treatment, and that can range from over-the-counter treatment, including anti-inflammatories such as ibuprofen can be quite effective for especially during the time of the month when you're having your period, if you are having periods, and then there are several non-hormonal treatments that your GP could prescribe you to help with pain and bleeding. So do go and speak to your GP about that even before you've got the diagnosis. There's lots that can be done. And then the hormonal treatments, a lot of the hormonal treatments are types of contraception, and they are not necessarily being used for contraceptive purposes, but here they will help with the endometriosis symptoms, and they can be taken safely without needing a specialist diagnosis, and there's lots that the GP can do to help you with that. Then the more specialist end of the treatments, thinking more about either hormone blocking treatments, which are sort of stronger, more regulated treatments that would be given by a specialist, or surgical options. They are things that you could then go on to discuss, once you've got that established diagnosis. And then the other thing to just mention with the treatments is there's a lot you can do to try and help with this condition, just going back to basics in terms of looking at your lifestyle, and so that's managing stress, which can impact your symptoms and the course of your disease. Do things that are naturally anti-inflammatory to your body, so that is making sure you're getting a healthy amount of exercise and a healthy balanced diet containing plenty of fibre, and it's definitely worth looking into that, because there's so much that can be done even without the diagnosis.
I think in addition to that, it's worth bearing in mind, with the exercise, that natural ways to lower your estrogen levels within your body is really important, because endometriosis is responsive to estrogen. So along with the exercise, actually maintaining a normal body weight can reduce the amount of estrogen that's circulating in the body, and being careful about alcohol and caffeine is also another important factor.
Great. And I mean, obviously we're talking about something that not only has all of the kind of physical manifestations that you said within your body, but also impacts yourself in other ways too. So you were saying, you're dealing with pain, you're dealing with fatigue, you're dealing with also the mental strain of the fact that you have a chronic illness with no kind of treatment or a cure in sight. So I think one of the things that we were talking about too is also the mental health aspect that you're looking after.
Definitely. I think it's, I can't speak for all women, and I'm lucky that I have the diagnosis and had it quite young. But the toll that it takes on relationships, on family, on friendships, and on work can be huge. Having a chronic condition of any description at all that impacts your energy levels and your ability to concentrate and focus or get a job done is challenging, and it sometimes getting out of bed in the morning is really hard. But you just have to keep going and find ways to push through it yourself, and whether or not it's things like changing your lifestyle and making sure that you eat right, sleep right, don't drink too much, try not to drink too much, and just kind of, you have to work a lot harder to take care of yourself, whereas the average 22-year-old can go out and hit the town and party every night, and they can bounce back the next day. That would knock me out for 2 weeks, and I know that now, but I didn't before I was diagnosed. So I think it's about living with more awareness and living with more of a sense of self, and identifying those times of the month when you know that it's going to be a nightmare. This week I've got penciled in here, it's going to be a nightmare. I'm going to struggle with work. And I think it's about having conversations with those people in your life, whether that be family, partners, employers, and saying, you might have to cut me a little bit more slack during this week. I will still show up in the best way I can, but my best sometimes isn't the same level as somebody else's, but that's okay. And coming to terms with that has really helped from the mental side of things.
Well, and I think that's why it's so important that we're having these conversations, that we're putting information out there. I know there's a growing movement on social media, especially on Instagram, of people kind of saying, look, the horror to the, kind of just saying, look, this is normal and this is okay. It's really important about people being able to be more open and talk about something that feels taboo, but we can't move forward. We can't help people. We can't support people if it's something that people are too scared to talk about.
I'm not sure why it comes across as taboo, because it impacts 1 in 10 women. That's a lot of people in this room. It's a lot of people. So why is it something that we're not more open about?
Yeah, I mean, I think when we live in a world where people are still afraid to kind of talk about periods in general, and then you're going into an extreme period and extreme pain, it just asks people to sometimes have more open conversations than maybe they're used to being able to have. And especially, as you said, it's one thing maybe talking to your friends or your parents about it. It's quite difficult going to a boss and kind of saying, this is what I've got. But again, I suppose having a name to it and having a diagnosis. So instead of just going, oh, I've got my period and it's a bit harder this month, or I'm going to struggle. You can actually say, no, this is a medical chronic condition that I'm dealing with.
It's classed as a disability as well.
So that's interesting.
That's another thing.
And that's also something that your GP can help you with, even if you haven't got the diagnosis. If you're having these debilitating symptoms, they can do you a medical certificate that you can take to work and say, look, I am having investigation for a gynecological problem. It doesn't even have to give any gory details, but that will at least give you some power so that you don't feel like you're having to try and explain this very complicated problem.
Well, then it's just another women's problem that,
Exactly.
oh, woe is me, like my period's bad this month. It is so much more than that. There's so much more depth to it, but like you say, having that piece of paper, in a way, it is just a piece of paper, but having that gives you the power and the control to say, actually, this isn't normal, it's not okay, and I need some support with this. Really.
Yeah, and a lot of women probably don't realize that they can get that from their GP, that they can go and get something like that, or possibly be signed off, because as you said, it's not just the pain and the fatigue, but also even for the mental impact, especially on that first diagnosis. It can cause a lot of stress and kind of mental health stuff. So being able to know that support system does exist. Now, there's been a lot in the media about how women's pain is often dismissed. What happens if, there's a woman that goes in and explains to her GP, I've got these really painful periods, I'm going through this, and they're just told to, have some paracetamol and wait it through, or try to grab a hot water bottle, and they just feel like they're not being listened to. What would you recommend they do?
They haven't got the right GP.
Yeah.
That is just simply the answer. If you feel like that for any condition, man or woman, then you need to go and ask to see someone else, and you're well within your rights to do that. You need to find the right GP, because this GP is going to be on this journey with you, and you need to work together. And we were talking earlier about being an advocate for your own health, but your GP is there as an advocate for you too. It's just really important that you find the right one who works for you.
Yeah, I think I found for a while when I was younger, I felt like I was making a lot of noise but not getting any feedback at all, or really being heard. And it found meeting the right GP and almost like being listened to or believed for the first time, that it's not just in my head, this is a problem.
Yeah.
And it all changed when I met the right GP, met the right partner. But yeah.
Unfortunately, this is a huge historical problem with a lot of health conditions, not just this one, that basically we have a very old-fashioned structure to not only our culture but also the health system, in that women's problems aren't always taken on the same serious level as potentially a man's problem, and that dates back thousands of years, that there's been lots of issues with this, and women are expected to put up with pain, and that it is, like as we said, like a woman's period type problem. But it's really frustrating that we're still living in this modern society that still has these very sort of outdated foundations, really, and also even in general practice, the way our training is, there's a lot of doctors that won't have had much training in obstetrics and gynecology, or women's health problems, and that's not necessarily their fault, but they just don't have the knowledge that they need, and I think the whole system needs to get better at educating all primary care providers, so all GPs should have a better awareness of these types of conditions so that we can help more people, because it's misunderstood even within the health community.
Well, I think we need to be careful too to not force too much responsibility onto the women themselves. If they go in and they're dismissed, it's very hard to say, well, you should have fought harder to be heard, or you should have really pushed back and told them how serious your pain is. when you're going into a GP, there's a natural power dynamic there of if the GP tells you not to worry, you're going to say, okay, well, maybe I shouldn't worry. So I think your recommendation, though, that you could go to a different doctor is a really good one. So you don't have to necessarily be more forceful as a person, just find somebody else to listen a little bit better. Or online communities. So I think that's one of the things that's really nice about the advent of kind of digital health communities and these conversations is that, you know, there is more support out there. You can find more things online. You can learn about more women having this. You mentioned kind of 1 in 10 women. There's tons of celebrities coming out now talking about the fact that they have lived with this their whole lives. You know, it's not some kind of rare disease. It's actually extremely
really
common.
Not. Yeah, very.
So I think that's also really great too in terms of people not feeling alone in this journey. So interestingly, when we're talking about kind of action for this, and March is actually Endometriosis Action Month. It used to be advocacy, now it's action. But not much action seems to be happening in this space. In France, you know, recently they have just made it actually a health priority. They're going to be investing into it. They're looking into more research and more clinics, and yet nothing's really happening that much in this country. As doctors, what kind of support would you like to see to try to help improve this space?
I think it has to be, like you said, it has to be on a multi-level, and it has to be system-wide, the improvements in this area. It doesn't have to be down to the individual to advocate for themselves. The research needs to be done, and there are a couple of bits of current research which will hopefully improve things, and we can put some links to this at the end with the Wellbeing of Women portal. They are a not-for-profit organisation that are trying to do more research into women's health problems, and I know that they are doing a research project currently looking into non-hormonal treatments for endometriosis, and the treatment they're looking at currently is like a very low dose of a type of chemotherapy to treat the abnormal growth of the tissues, and the initial results of that do look promising as an alternative treatment for endometriosis, but obviously these things will take time. The other area of research which is really important is the actual going back to the initial diagnosis, and so it would be really good if you didn't have to have quite, albeit a small operation, that is a very invasive thing to have done, to have a general anaesthetic, be put to sleep and have a surgery to your abdomen to have that diagnosis. Actually, hopefully in the future we will have better imaging, so they are looking at how can they get either MRI scanning or ultrasound scanning based diagnosis. At the moment not possible with the current technology, but I think there's a lot of potential there, and actually on that basis of the ultrasound and MRI technology, they're also doing some research into whether you can use high frequency ultrasound treatment for the endometriosis as well. So I think there's lots of potential avenues, but the problem is getting the funding, getting through those research processes which are lengthy, and then the other thing is just like improving awareness, which is what we're hopefully trying to do. But going back to your point, Caitlin, about what they're doing in France is really impressive, because they're trying to get employers more aware of this diagnosis, and I think if we can do more on that front here to help employers to understand, this is something that could potentially take a woman out of work multiple days of the year, and actually if they had a better understanding of it, then they can support them better and make them ensure that they can actually stay working for that job for the best of their abilities.
I think in France as well, it's a government-led scheme, isn't it, there to highlight the need for this. There is a paper published actually by the APPG, who are a multi-party group, advisory group from our government, who did some research at the beginning of 2020, who again highlighted a massive need for just this same thing. Unfortunately, it's not supported by the House of Commons or at present, but again it just highlighted and gave us more evidence to suggest that this is something that really needs to be looked at.
Yeah, well, I think there's something about when you get Emmanuel Macron going on to the state news and talking about endometriosis and how it is a health condition, not this is a women's problem.
Yeah.
You know, you've got a very powerful, very influential man not having any issue speaking about it, and that normalizes it in a good way. It helps open up that conversation and makes it feel like it's just a normal health conversation to have, which I think, you know, that's really what a lot of women want, right?
I think as well you're separating the linguistics completely, because it stops it from being a women's health problem to being a health condition. It's a chronic health condition. It doesn't really matter, it's kind of irrelevant if it's a women's problem or not. It should be taken just as seriously as any other chronic health condition. That does impact the amount of days you can spend at work. You know, it does impact things like productivity. It has the impact on a whole range of different things across society. So it's a problem that we all face, whether it's your mother, your sister, your auntie, your daughter. I can guarantee everyone in this room knows someone with endometriosis, me being one of them. Everyone knows somebody that suffers with a condition. So it impacts us all, and we should equally all be taking an approach to help either support other people or just raising awareness that it affects a lot of people. We should be coming together to fix it as a whole, not just women on their own fighting to fix it.
I think the gender argument is really important because we have to remember that this is a condition that affects people who were assigned female at birth.
Yeah.
That means it affects transgender, people, non-gendered patients, and that opens up a whole other issue in terms of why these people should be treated. Whether it should be in a women's health setting or not, there's a whole other argument there. This needs to be a non-gendered
Completely.
health condition.
And unfortunately, I think it will be taken more seriously if you take the gender out of it, which is a shame. But for me, I think that's the next step. Personally, I think it's something that you can feel very alone with. So for me, it's about creating conversations that are more than just, oh, I have painful periods. It's having more depth and having more of a support network and being able to talk to anybody about it and removing that stigma. For me, I think that would be the next really positive step.
Fantastic. So, any last passing things you guys would like to share with anybody, or advice you'd want to give anyone that's either going through it or suspects they might have it?
It's been quite doom and gloom. It's all been quite negative, but I think it is difficult to live with, but it's not impossible. And I find myself saying frequently, there are far worse conditions that you could have, and it's just about, for me, it's about readjusting what my expectations of myself are. And sometimes, you need to cut yourself some slack, and that's okay. And it's important to be able to do that. And you will get through it.
Well, and I think that, on the positive side of things, we're talking about this.
Yeah.
People are talking about online. You mentioned there's a bunch of new treatments that people are starting to look into. And the more we can share that those things are happening, the more pressure we can put on people to kind of explore with that. Is there anything else that you two like?
I think just stressing that if you have any concerns about the symptoms that you're experiencing, please go and find a GP who will listen. I think that's the only thing really that I wanted to stress.
Yeah, and I second that totally. Just get the support. If you don't feel you can go to your GP, then try and get support from family, friends, or someone that might be able to help you to look into this, even if it's not the traditional going down the NHS route. There are lots of things that can help initially, but eventually please do try and get to that diagnosis if you can.
Perfect. Well, thank you all so much for joining us, and we've created quite a bit of content on this topic as well. You can hear Ellen's story and her personal journey through this, as well as a really helpful guide to what is endometriosis that's been provided by Caroline. And we've got some written guides and helpful things on the site. So thank you very much for joining us.